Okay, so hello everyone and a very good afternoon. I am Rotaractor Diya Karbari from Rotaract Club of Thane Greenspans, and today we are conducting a session for breast cancer awareness. And with us we have our speaker, Dr. Shobha Sanna. Ma'am, welcome to the session. So, just giving a short introduction about her. She is a trained breast cancer surgeon and a trained oncoplastic breast surgeon. She has contributed in various national and international conferences and has been invited faculty at various conferences. Her special interest being breast cancer awareness and oncoplasty breast surgeries. And prior to her appointment, she has worked at various prestigious institutes of the country. Welcome, ma'am, to the session, and you can take over the session from here. Thank you.
Thank you so much. Hi. Um, can you all see my screen?
Yes, ma'am.
Yes, ma'am.
Yeah. Thank you. So, you can chat or you can unmute yourself and ask me anytime if you want to know about anything. Just a general thing. I just want to know what do you all know about cancer? We are talking about breast cancer. But just a general, what actually do you know about cancer? What is cancer? Can somebody tell me? You can unmute yourself and say. Okay, no one. Fine. Why are we talking about breast cancer just because it's October? No, the only reason we are talking so much about breast cancer. Yeah, sorry. You wanted to say something? Okay. So the only reason why we are talking so much about breast cancer is that the incidence is increasing in our country rapidly, and not only the incidence which is increasing, the number of cases. Not only that, but cancer in young women are increasing more in our country. That is why we are talking so much about breast cancer, breast cancer. And okay, I did not get the answer about what is cancer. So this is how a cancer cell looks on the microscope. So what is a cancer actually? In our body, there is a mechanism that if there is problem in any cell of the body repairs the cell by itself. If there is any kind of damage, there is DNA damage, the body keeps on repairing it. But sometimes these repair genes are faulty. So if some cell has undergone any damage, no repair is happening, that cell becomes a mutant cell, which is the cancer cell. And without any check, it keeps on growing. So then what the growth and it keeps on growing, that is what is called as cancer. It can occur anywhere in the body, in any organ. If it is happening in blood, it is called as blood cancer. If the same thing is happening in bone, it is called as bone cancer. And if it is happening in breast, then it's called as breast cancer. Now, what is the breast made up of? So the breast is made up of these glands, the red cloud-like structures which you can see. They are the milk producing glands. So when a female is lactating, she is feeding her child, the milk is formed in these glands. And then it is transferred from here through these channels, which are called as ducts, from these cloud-like structures to the nipple through these channels. So the cancer usually occurs either in these glands or these ducts, which are transferring milk from these glands to the nipple. Apart from that, breast also has fatty tissue and some amount of connective tissue. But the cancer only forms in these glands and the ducts. Uh, if I would be talking to you all a few years back, just before COVID, my general statement would be breast cancer is the second most cancer in the world. But now, breast cancer is the most common cancer which occurs worldwide. So earlier it was called to be a disease of old age. Like you can see, commonest was in 50 to 60 years of age group. But now, since the incidence is increasing and young age incidence is increasing, so now we say from 25 to 50 years, there is highest incidence. I have written Ahmedabad there, but this is the common scenario in all urban cities of India. So this same thing would be for Mumbai, for Delhi, for anywhere else except for Bangalore. Bangalore has the highest incidence in our country, that is 36%. For other urban cities, it's around 32%. What does that mean? Is that if 100 female are coming with cancer to our hospital, then 32 of them would be having breast cancer, which is a very high number. It's the commonest cancer. So, in our lifetime, it is estimated that if there are eight females standing, one of them would develop breast cancer in their lifetime. But why are we talking so much in our country? See, our country does not have any national policy for screening of breast cancer as is available in Western countries. So by the time a patient presents to us is very late. The later you go to the doctor, the more chances of you dying because of the disease increases. So more advanced stage you come, your survival keeps on decreasing. There is severe lack of awareness and screening in our country. But I'm very happy, such a young age group, you all are youth and you all asked for an awareness program. That's very good. That shows that how our youth is going to change this scenario later on in the country. At the moment, there is severe lack of awareness and screening in our country. So the average size with which a female walks into my OPD is around 2 centimeter or 2.5 centimeter, which is the size of a lemon, which is not good. Breast is a superficial organ. You should be able to detect something which is even smaller. But in our country, usually female come to us when not when they notice it, but when they start having problems because of it. So, breast cancer does not occur because of any one reason. There are multiple factors which contribute to breast cancer, which contribute in increasing your risk for breast cancer. So, there are some factors which is not in anybody's control, but there are some factors which we can control and decrease our risk of getting breast cancer. So let's talk about those factors which we cannot change. So all females are at increased risk of getting breast cancer. As our age increases, our chances of getting breast cancer also increases. If somebody has had a family history of breast cancer, their chances are increasing. But that does not mean that if somebody does not have a family history, they do not have. All of us have got risk of getting breast cancer. If somebody has already had breast cancer or any other cancer, their personal risk also increases for getting either a recurrence, that means that cancer again coming back, or a new cancer. There are few races in which breast cancer is very prevalent. So, for example, there is a Jewish community, especially Ashkenazi Jews, in which almost 90% of females they develop breast cancer. If somebody has had radiation for any other cause, radiation to the chest wall, then their chances of getting breast cancer increases. If there are known genetic mutations running in the family, then your chances of getting breast cancer increases significantly, around 90%. If somebody has started their periods really early in life and it keeps on going for a very long time, that means early periods and late stopping of period, then that person also has got an increased risk of getting breast cancer. And why is it so? Because every month your body prepares yourself to get a new baby. So all the uterus lining increases, keeps on increasing to welcome a new baby. Then the body gets the signal that no, this month there is no baby at all. So then the periods happen because these lining keeps on shedding. So this is what we know because of hormonal changes it is happening. But the same hormones are acting on your breast also. The same ovarian hormones which are acting on the uterus and they are leading to periods, the same hormones at the same time are acting on your breast also. So it causes the wear and tear of all the cells in the breast. So the longer you are having your periods, the longer is the time for wear and tear. So you are increasing your risk of getting breast cancer. This wear and tear stops when you get pregnant. It also stops when you breastfeed your child. So the more you get pregnant, the number of times the pregnancy increases, you are decreasing your risk of getting breast cancer. Now, these are few factors which we can control. Just as I said, breastfeeding protects you from getting breast cancer because during the time of breastfeeding, that wear and tear halts. The hormonal influence which causes the wear and tear of the breast cells, it halts. So if you're breastfeeding your child, you are decreasing your risk for getting breast cancer. Nulliparity, not having children, increases your risk of getting breast cancer. Alcohol intake, smoking, it increases your risk of getting breast cancer. Obesity, especially post-menopausal obesity. That means obesity once periods has stopped in any female increases your risk of getting breast cancer significantly because then the extra fat tissue in the body is secreting the hormones. The earlier when you're getting the periods, the hormones which are secreted by ovaries, which are causing wear and tear of the breast, they are in a controlled fashion, happening monthly in a routine way. But when somebody is obese, postmenopausal, the fat which is secreting the hormones can occur anytime. So your risk of getting breast cancer increases very significantly. If you exercise, you are decreasing your risk of getting breast cancer. There is one more factor which increases your risk of getting breast cancer, which we can control, and not only breast cancer, multiple other diseases can be controlled if we control our stress levels. Now, if somebody has to have breast cancer, nobody can prevent it. But you can lower your risk of getting breast cancer by controlling these factors which can be controlled and also by maintaining a healthy weight throughout your lifetime, by not smoking, by being physically active, and by not consuming alcohol. You will decrease your risk by 38% of getting a breast cancer. So, in breast cancer, the earlier we detect, you increase your survival that much. So, we always say that early detection is going to save lives in breast cancer because we can catch hold of breast cancer even when the cancer is not formed in stage 0, that is pre-cancerous stage. If we actively look for it, if we are screening for it, then we can catch hold of it and we can prevent that. We treat it so that the cancer does not form there. So all of us should be aware of our breast. Our breast is not something which is static. It's a dynamic organ. It keeps on changing in our lifetime. In a female's lifetime also it will keep on changing. Your breast would never be same what it was a year back. And even in 1 month also, according to your period cycle, the breast will keep on changing. So we should be aware how our breast feels and how our breast is. So we should be aware. We should be breast aware. What is breast awareness? Is knowing what are breast cancer symptoms, looking out for them regularly, and if you encounter any symptom which you think could be a cancer or not even could be cancer, anything which is different from what you examined in the previous month, then you should go and show it to your doctor. As I said, we cannot prevent cancer, but if we detect early, we can surely beat it. Breast cancer is absolutely curable, but only if we detect it on time. So that is why every female should go for screening for cancer, because what screening does is that we can catch hold of breast cancer even before the disease is formed. So breast self examination is a must for everybody. But what I'll do is I'll explain it to you later on while we finish this talk. After I switch on the camera, then I'll show you how to examine your breast. Clinical breast examination should be done annually for everybody over the 40 years of age group. For somebody less than 40, it also depends upon your personal risk of getting cancer. So if there is a known genetic abnormality in the family, your clinical breast examination would start much earlier than 40 years of age group. So in that case, you need to go and see a doctor. So they'll tell you how frequently you should get examined. Otherwise, no family risk, no increased risk factor. You can get your breast examined every 3 years by your general practitioner, your gynecologist, your breast surgeon, your family doctor after the age of 20 years. Each and every female at the age of 40 years should get a mammogram. Only with a mammogram we can detect if a cancer is going to be formed somewhere or not. And we can treat it so that the cancer does not occur. Annually, nobody needs a mammogram. So once a female gets her mammo done at the age of 40 years, after that, how frequently it should be done would be decided by your treating breast surgeon. It would depend upon what is the quality of the breast, what is the density of the breast, are there any risk factors, are there any family history, are there any personal risks. So first mammo at the age of 40 years, after that, as and when your doctor says. Okay, commonest symptom of breast cancer. I am looking at chats. Now I'm giving you 2 minutes. Just tell me what is the commonest symptom of breast cancer according to you. Till that time, there's a question here. I'll just read it. So all of you, just write whatever you think is the commonest symptom of breast cancer. Okay, so iPhone 12 mini, you have asked a question that you have a palpable lump in your breast, which is behind your nipple. Okay, so you should get it checked by a doctor. No, please go and get it checked by a doctor. Mostly it would be not cancer and something else, but any palpable lump in your breast, go and get it examined by a doctor. I'm not getting any answers. Please write down what is the commonest symptom of breast cancer. Yes, lump or protruding portion in the breast. Yes, you are good, right. It is a common symptom, but not commonest. Anybody else? Lump below the armpits, you're right. It is a symptom. Lump in the breast, yes, it is a symptom. Okay. Swelling, yes, it is a symptom. Fine. Okay. So the commonest symptom of breast cancer is no symptom at all. You won't know that there is any symptom and you'll get breast cancer. That is why screening. Other common symptoms, as rightly said, is lump. Pulling inside. The nipple gets pulled inside. There is discharge from the nipple, especially blood-stained discharge. There would be dimples on the skin. Your skin may appear as the skin of an orange peel. There can be redness, there can be rashes, there can be lump in your underarms area. So these are common symptoms of breast cancer. How do we diagnose that you have breast cancer? So diagnosis is always done by triple assessment. But just now only we spoke about screening, that we should screen for breast cancer. Now what happens? What is the difference between screening and a consultation is? In a screening, you go to a hospital and you get your radiological examination done first. If you are above 40 years of age, you'll get a mammography done. If you're below 40 years of age, you'll usually have a sonography done, never a mammo below 40 years of age. And after that, you go and meet the treating surgeon and they will examine your breast. But if you're walking to the hospital with a complaint, First, you will be seen by a surgeon, and after that, any radiological examination would be done. So, this is the major difference between screening and going to a hospital with a complaint. So, any diagnosis of breast cancer is done by triple assessment. That means that person would be examined by a surgeon or a clinician. After that, radiological investigation would be done either in the form of mammography, ultrasonography, or if need be, then breast MRI. Then a biopsy would be done. Only and only biopsy can give you 100% diagnosis. So, there are many forms of treatment for breast cancer. Surgery can be done. Surgery for breast cancer, surgery does not mean removal of breast. No. Breast can be saved, breast can be reconstructed, and breast can be removed. There are multiple types of surgery available: chemotherapy, radiation therapy, hormonal therapy, targeted therapy, immunotherapy. These are few types of treatments which are done for breast cancer. But what you need to understand is no same two persons can never have same treatment. All the treatment designed for breast cancer patients are tailor made. That means your treatment plan would be decided only according to your disease. No two patients have ever get the same disease. So breast cancer is just one term, but inside that there are multiple different kinds of cancers. So each and every cancer is operated differently, it's treated differently. So these are just the treatment options given, but it is not that everything is required for each and every patient. No, it would always be tailor made according to your needs. As I said, that the later you come, your survival keeps on decreasing. So if a patient is diagnosed on screening with stage 0 breast cancer, that means the cancer has not yet formed, it is in precancerous stage, then after 10 years, almost all of them would be alive. The only reason it is written 90% here is that the deaths may have occurred because of some cardiac issue or some any other issue. That is why the number is not 100%. But stage 0, all patients would be alive. Almost all would be alive after 10 years. But if somebody comes to a hospital with stage 4 breast cancer, that means the cancer has spread anywhere else in the body apart from your breast and underarms area, then after 10 years, out of those 100 patients, only 2 or maybe 0 would be alive. So that is the difference between coming to the too early to the hospital and coming really late to the hospital. Now let's talk about few myths which are associated with breast cancer. All lumps in breast is not cancer. If 10 female come to the OPD with lumps, only 2 of them would be having cancer. 8 would not be cancer. Any other would be having any other type of lump. But if you see any lump in your breast, go and consult the doctor immediately, because if it is cancer, then it should be treated as early as possible without any delay. This is a very, very common myth that if you apply deodorants, antiperspirants, they will cause breast cancer. No, this is absolutely not true. You can keep on using all your deodorants, antiperspirants, perfumes. None of them cause breast cancer. Many a times, ladies would come to the OPD and then they will say that I had an injury to the breast, बच्चे का सिर लग गया था, हाथ लग गया था, and after that I got a lump. Now this is cancer, so that injury caused cancer. No, that is not true. Many a times, what happens is that when you have injury in your breast, at that time you are touching the breast. Before that, you never touched the breast. So the lump was there always, but you did not feel it because you have never examined your breast. So that cancer did not occur because of injury, but that injury led you to examine your breast, which in which you felt that lump, which is now cancer. Any kind of breast, small, large, big, small, can have cancer. If you have breast, you can have cancer. Breast cancer is absolutely curable if you come to the doctor on time. So, if you come on time, you are not going to die of breast cancer. It's absolutely curable, just like any disease. You'll get treated and then you're cured of breast cancer. So this is very common. You'll get WhatsApp messages also that don't wear black color bra, don't wear underwire bra causes cancer, don't wear a bra. These are very, very, very common messages which keep on circulating. Type of bra, color of bra, wearing a bra, not wearing a bra. None of it is related to cancer. Wearing a bra, not wearing a bra would not lead to cancer. So no, cancer has got no association with bra at all. You having a family history of breast cancer does increase your risk of getting cancer, but that does not mean that somebody who does not have a family history of cancer would not get it. 90% of female in our OPD have got no history at all. Only 10% of them have a family history or a known genetic mutation. So the incidence for hereditary breast cancer is just 10%. 90% would not have any complaints at all or any history at all. So for all the males here, men can also get breast cancer. It's not only females who need to check their breast regularly, but men also. And in men, if somebody has had breast cancer or is having breast cancer, then it spreads faster too. So men should also regularly check for breast cancer. Cosmetic breast implants don't increase your risk for cancer. Few years back, maybe 20 or 25 years back, there was a type of implant because of which different kind of cancer, lymphoma used to occur in women. But now those implants are not in production, they are not used. The implants available now are safe to use. So breast implants does not increase your risk of getting breast cancer. If somebody has got their breast removed, it does not mean that the cancer cannot come back. The cancer can come back either at the same place or at anywhere else in the body. And yes, most importantly, breast cancers are usually painless. So many a times people present to us very late that I am not having any pain. There was only a lump, so I did not come because it was not paining. And then by the time it starts paining, it is advanced very much. So usually breast cancers are painless. Now, as I told you, that 10% have a very high risk because of gene mutations. So they can go and consult in high risk breast clinics and discuss how they can lower their risk of getting breast cancer. Biopsy, surgery, it never causes the cancer to spread. No. So, lastly, I would like to say early detection saves life. All of us should be breast aware. And what I would do is, yeah, uh, let's take few questions, or should I teach you self breast examination first? I will. So how should we examine our breast? So breast should be examined by each and everyone. Even males should examine their breast periodically. But for all females, once you develop your breast, after puberty, start examining the breast. Those who have their periods should examine their breast between 5th to 7th day of your periods anytime. But post-menopausal women, those who have stopped having periods, can examine on any one fixed date. But the date should be same. If they're examining on first of 1 month, then the second month should also be on first. So it should be periodic examination. Now you should stand in front of the mirror, undress yourself, and observe how the breast is looking. Are there any skin changes? How is the nipple? Is the nipple pulled inside? Are there any visible bumps or lumps? Are there any obvious size differences between the two breasts? Once you see in the mirror, then what you need to do is you need to keep both your hands on the waist and press tightly, and then see, are there any visible differences? Then you need to lie down on the bed and examine your breast. So how do we examine the breast? Is with these four fingers, finger pads, not the tips. And you should not catch hold of the breast, because if you catch a hold of the breast like this, you will catch hold of the glands, and that you can feel that it is a lump, but it would not be lump, it would be normal breast tissue. So you need to touch with your finger pads gently. You have to start right from the clavicle to below the breast, the underside of the breast, and your arms area. Go in periodic fashion. Either you go vertically down or you go round around your nipple. So if you're going vertically down, start from the clavicle, your collarbone, and go down gently. Keep on pressing the whole of the breast, the underside of the breast, the underarms area. Then you just press your nipple once and see if any discharge is coming out. Do not keep on pressing the nipples, because breast is made up of all these glands and ducts. If you keep on pressing, then something would come out. So just press once and see, is there anything palpable, if you can feel anything. This which you did by lying down on the bed, same thing you have to do in the standing position also. For left side of the breast, use your right hand. For right breast, use your left hand. And now the same thing needs to be done while you're having a bath in the shower with soap applied to your hand. Many a times, many of the lumps are not felt uh, like this only. They are only felt after applying soap in your hands. So you have to do it in three positions: once in front of the mirror, once lying down on the bed, and once while having a bath. So these are the three positions in which you need to examine your breast. Anything which you find which was not there the previous month, please go to the doctor, and you have to examine your breast regularly. So, any questions? Anything you want to ask? Can we revisit the symptoms page? Okay, I'll tell you. I just stopped sharing my screen. So, the symptoms are lump, nipple discharge, pulling inwards of the nipple, any change on the skin of the breast. There can be redness on the skin. There can be visible veins on the skin. There can be rashes on the skin. The skin can look like orange peel. There can be a lump in your underarm area. There could be a visible difference. See, no two breasts are alike for any person, but a visible difference. Like the previous month, both were of the same size, and now one has gone up and one has gone down. Change in the position of nipple. All these things are symptoms of breast cancer, and they need to be checked. Uh, sure, I'll drop a message in that. Group chat with names for whom you can consult in Gurgaon. See, you should get an ultrasound done directly or not. I won't be able to advise because I don't know anything. I don't know your history. I don't know your age. So I won't be able to comment upon that. But yes, I can share you people whom you can visit in Gurgaon. Thank you. Are there any other questions? Otherwise, we'll end the session.
Guys, is there anything that anyone wants to ask?
Okay, if you don't want to ask in a general forum and you do have questions, feel free to drop me a message anytime and I'll answer you.
Okay, so thank you everyone for joining us today for this session on breast cancer awareness. And to our speaker, thank you so much for your expertise and your passion. And your words, I'm sure, have really added up to a lot of knowledge about breast cancer for all of us. And let's turn this inspiration into an action that's raising awareness and supporting those who are affected. And I really hope that everyone is going to take a lot from this session, and especially the girls are going to implement whatever you have said and whatever you've told us. So yeah, thank you so
And also
much
teach
for
others,
being
teach
here.
others. Encourage everybody in your family to examine their breast. And even the boys, males present here, do that please. Okay. Thank you.